He's on.
I am? I'm on now. Okay, very good. I mean, so in order to save Medicare, strengthen it for today, save it for today's seniors, but make sure it's around for tomorrow, you have to have a bold plan. You actually have to be able to have a plan and put together to get you there. And what Miss Boockvar talked about, it sounds very good, but it's not even close to creating solvency within the Medicare program. She talked about eliminating fraud. We all want to eliminate fraud. We talk about eliminating fraud in Medicare for 40 years. Not going to get you there by itself. Negotiate drug prices. Well, I have news. We've been negotiating drug prices under Medicare Part D from the beginning of Medicare Part D. And that has worked to the extent that the Medicare Part D program that started in 2003, while imperfect as a program itself, the competition within Medicare Part D has resulted in an underspending, a savings of about 30 to 40% in that part of the program. So I actually agree that competition will lower costs and increase quality and choices for the seniors. But actually what Ms. Boockvar suggested was not competition. She suggested that Medicare negotiate directly for the prices. That's the federal government price fixing with pharmaceutical companies, which won't work. And the third issue, she talked about cost containment. Again, it's easy to say we want cost containment. This is how you do cost containment. Number one, medical liability reform, which she will not be for because the trial lawyers won't permit her to be for the ending the practice of defensive medicine in this country and true medical liability reform. This is the problem with her answer. She is for, because she's for President Obama's Obamacare, the Affordable Care Act, she has continued to support an immediate cut of $715 billion from Medicare's current beneficiaries. So today's beneficiaries, today's seniors, will see as a result of that bill an immediate cut of $715 billion. The way you save Medicare is you don't use it as a piggy bank for a brand new program. So eliminate Obamacare. That's the way you do it.
Thank you. This is back to you, Michael Fitzpatrick. Pennsylvania has one of the nation's worst Medicare malpractice climates. How do you plan to address this if elected to Congress?
I think that's how I was wrapping up the last question. I am a co-sponsor of a bill called the Health Act. The Health Act would enact medical liability reform by limiting damages, non-economic damages in medical malpractice lawsuits. In other words, limit pain and suffering damages in malpractice cases. The way that would affect Medicare and Medicaid is it would increase the dollars available because for all senior citizens, because doctors could end essentially the practice of defensive medicine. A recent study came out from Harvard University where doctors reported that for every 4 processes or procedures that they order, for every 4 tests that they order, 1 of them was not required but was ordered for the purpose of protecting that physician against the potential of a malpractice suit, a frivolous suit that would be filed against them. And so Pennsylvania has one of the worst medical liability programs in the country. It's unfortunate the federal government has had to enact, as we passed through the House, the Health Act, medical liability reform at the national level. It should be done at the state level. Pennsylvania hasn't done it. And when Pennsylvania doesn't do it, the federal government's required to do it because it's costing all of us significant dollars each and every day.
Thank you. Ms. Boockvar.
Thank you. I'm just going to address the last piece of the last answer, which is the $716 billion. Congressman, it's hard to believe that you again and again feel completely fine about lying to the voters here. There is only one candidate in this race who has voted for $716 billion to be put into effect and taken out of Medicare and how providers are paid, and it's you. And yesterday, you denied yesterday that the Ryan budget did exactly that. Congressman, you clearly haven't read the Ryan budget, so I'm happy to have my staff provide it for you. I have 3 articles here with me today. The New York Times, Bloomberg, President Clinton have all said that, in fact, the Ryan budget did exactly that. It changed the way providers are paid. In Obamacare, you voted for it twice. You clearly haven't read it. So that's one thing. We need to be doing cost containment across the board. As I mentioned before, my father was a doctor. Unfortunately, he passed away 3 years ago. 2 of my brothers are doctors. My grandfather was a doctor. I know how hard it is to deal with unfair and unfounded lawsuits, and we need to make sure that we are not having frivolous lawsuits. On the other hand, we have to deal with making sure that we have quality of care and that we allow people who are hurt from this to recover. And that's a principle of our society. And don't ask me to tell my neighbor or my family member that their child's life is only worth X amount. We have to trust our justice system, which allows the jury to assess these cases, and that's what I would do.
Okay, thank you. We turn now to the closing section. I'm going to give the candidates about 10 seconds to breathe because I'm going to take a personal privilege here, which is to say goodbye. I have to leave earlier to catch a plane, but I want to thank all of you for your cooperation right now. And realize, too, that this is one event. You know that you can find the candidates for pursuing your other questions, etc. And I used to be a teacher, and you know that teachers are always teachers, so I'm giving you homework. I know that you're going to vote because you're here. But I'm going to ask you to make sure that 3 additional people vote. So it may be that you need to remind your grandson, who's off in college, to vote. It may be that you drive your neighbor to the polling place, whatever it takes. But please try to see that we increase our voter turnout. All right? And Carla's going to take it back to do the closing statement with the 2 people.
Thank you very much. We're going to have a 2-minute closing statement and the toss of the coin. Mr. Fitzpatrick, you're first.
Thank you, Carlo, and thank you to the Central Bucks Chamber of Commerce and the Upper Bucks Chamber of Commerce for organizing the event and bringing us here. As I indicated in the opening, this is a critical election, an election that, in my view, will really turn on jobs and the economy. We have to turn our country's economy around, put the country's fiscal house back in order, and get people back to work. We've heard great discussion here today. I think that most of the policies that we need to put in place, my opponent would oppose if elected. You know, she'll be opposed by the trial lawyers if she tries to enact medical liability reform. She's come out today for new regulations on every small business of 15 employees or more, and by permitting the largest planned tax increase in our nation's history to go into effect on December 31 of this year. That's an immediate tax increase on 1 million small businesses. If we want to get people back to work, we need to rely on the small and medium-sized business sector of our society. And in order to do that, you need to do what the small businesses have requested of their representatives. Lower taxes, simplify the tax code, reduce, don't increase regulations, and do something about health care costs out of control. My name is Mike Fitzpatrick. I've been your county commissioner for 10 years. We adopted budgets. We had a growing fund balance. We have a AAA bond rating in Bucks County. That's the way I operate and administer county government. That's the common sense I want to bring to the nation's capital. We need to adopt budgets, which is why I support the No Budget, No Pay Act. We need to adopt a pro-growth economic strategy of lower taxes, less government regulations, and true healthcare reform. If we do what I think in our hearts and in our guts we all know is required, we can turn this economy around, we can reduce the unemployment rate, we can have a comprehensive 21st century energy strategy, and move this country forward. Thanks for having me.
Thank you. Ms. 2 minutes.
Thank you. Thank you so much again to all of you for having us here today and being part of this. Look, as we started out by saying, and you all saw during the last hour and a quarter, there were 2 very different visions put before us today and before us for the last many months. And if you are not happy with the representation you're getting in Washington, if you think that you have the right to deserve more from our representatives, then you have to start by changing the people that are there. Congressman Fitzpatrick wants to say that he's independent, but again and again and again you see that the votes speak louder than words. And if you're looking for somebody independent, then you need to elect somebody who makes these very tough choices. And that means voting against the party when the party's going to put forth a budget that's going to hurt middle-class families and seniors and soon-to-be seniors in order to continue to provide tax cuts for the wealthiest 1 to 2% of Americans. You need to support somebody who actually votes with the voters of Bucks and Montgomery County, who support Planned Parenthood to make sure that we can make sure that our families and women have access to these critical services. We need to make sure that we vote for somebody who is concerned about public health and safety, who's working to make sure that we boost our businesses and focus on eliminating the disincentives that we have before us today. Look, we've got some incredibly tough challenges here, but it takes somebody who's truly not only an independent thinker, but also a leader, and also somebody who's willing to work to bridge differences. This is what I've been doing my whole life. I'm very, very proud to be endorsed by the intelligentsia who said exactly that. In order to move forward from here, we need a truly independent thinker and somebody who's willing to work across the aisle and in our neighborhoods to move things forward for all of us. I ask you please for your support on November 6th, and in the next 10 days, we'd love to have you involved in our campaign. Kathy Boockvar, thank you so much for your support.
One more moment, please. I want to thank our candidates for their participation today, and I want to thank our audience for coming out this morning. We're all going to go into the voting booths shortly, and now we're much better informed in our community. On behalf of the Chamber and the League of Women Voters, I want to ask you to exercise your right to vote. I do want to thank WFMZ. They're going to be obviously taping our debate. It will